Morning, everyone. So my part is going to be on Dobhoffs. Dobhoffs are going to be used for different reasons versus an NG tube. Sheena went over the reasons why we would use an NG tube. The reasons why we use a Dobhoff is for mechanically ventilated patients requiring nutrition, which is going to be a lot of our ICU patients, altered mental status patients require nutrition, patients with swallowing disorders. You can also use the Dobhoff for feed-ins and for medications. It's not going to be used for any kind of decompression. So the insertion is going to be the same technique as Sheena showed you with the NG tube, but there's going to be an additional step that you're going to use for insertion. When you grab your packaging, there should be the Dobhoff tube in itself and something called a CO2 detector. This is going to be very important for your use during insertion of the Dobhoff. So we do all our measuring the same way as we did with the NG tube, but I do want to talk about some parts of this that is important before we do the insertion. The first thing is that there's a stylet in place. This stylet will help guide the Dobhoff into place. It's very important to leave that in there until you get confirmation from your physician versus after he reads the x-ray that it is in the correct place. It also has a weight at the bottom. This helps with gravity to get to where it needs to go. And it also helps with the x-ray to see where the end of the tube is. So let's get ready to insert. We did all our measuring. I'm gonna grab our CO2 detector. You're gonna go ahead and close this part where the stylet is nice and close so no oxygen's going in that way. And I'm gonna go ahead and put this on the other opening. Right now it's purple, which is just what we want. We do not want it to turn yellow. Yellow means that there's CO2 detected, and that means you're going towards the lungs. So when you're at 30 to 35, you're gonna stop and go ahead and press your CO2 detector. If it stays purple, that's good. We're gonna keep going until you're measuring where you need to go. Okay, some other things I want to say, again, like I said, you're going to need confirmation with x-ray before you can use it. And as far as documentation purposes, what you'll record on Meditech is the number that is on the tubing where we measured. So that needs to be the same all the time. If your measurement is, let's say 50 for your patient, and you go in the next time it's 45, it's probably not in the right place. Other things that we wanted to review, because this changes every once in a while, is our tube feed-in hours. Our ready-to-hang tube feed-in, along with all the tubing, is good for 24 hours. If you have cans, when you're going to use the two-bag system, that's good for 8 to 12 hours. Other things I want to go over is troubleshooting. Only use water to clear the clog. And if that doesn't work, go ahead and ask the doctor for an order for pancreatic enzymes. The last big thing I want to tell you is about enteric-coated or extended release medications. You cannot crush those medications because that decreases the efficacy of the medication. You're going to have to call the doctor to get a prescription change. So with our Dobhoffs, we know that sometimes our patients will want to pull those out. So we'll use something called a core grip. Core grip is, we used to use a Bridle, but now it's called a core grip, and this will help keep that Dobhoff in place. We're going to have a separate video on insertion of the core grip, and if you want practice with it, me and Sheena do have a mannequin available with this little guy available for practice. If you have any questions, just let us know. Thank you.